I'm excited to be joined today by Sam Kent, who's a second year fellow at the Johns Hopkins University School of Medicine, and Tiffany Truong, who's a second year fellow at the Keck School of Medicine at the University of Southern California. Sam, Tiffany, thank you for joining us today. As you reflect back to the beginning of your fellowships a couple of years ago, I'm curious as to what one thing you wish you had known on day one. So, Sam, I'll start with you. What's the one thing you wish you had known that day?
I've kind of realized one thing that, efficiency is pretty much the name of the game. Habits and processes are there for a reason, in the end. We think that discipline at some time can be constraining, but it's actually quite liberating. You have to develop a way that you start your day, say, particularly getting in at a set time, adjusting it according to various commitments, and also say, for example, how you're approaching a new consult. Gathering how you gather information about a patient from the electronic health record or any other record, for a matter of fact. A haphazard way, will only impede us per se. So if you develop like a thoughtful system by which you're, approaching your day or, consults, as a matter of fact, I think you'll be in good stead. Also, I think that if you combine that with diligence, you pretty much are dealing with the ultimate combination. I kind of remember dealing with a case of hypercalcemia one evening, staffing it with the attending, and thinking that I had it all going. But next morning, the attending, who I kind of look up to quite a bit, came back and said, yeah, that's not probably why the patient has hypercalcemia. And he's pretty much gone through records from 2004 for that patient. So I think it makes a very big difference. To combine efficiency with diligence, I think it's probably the best way forward.
And Tiffany, what about you? What do you wish you had known from day one?
Yeah, I definitely agree with Sam about time management and efficiency being a major skill to develop. I think that's something that you think you're only going to do once when you start intern year of residency, and then you find yourself kind of all back at it in the beginning again, at the beginning of your fellowship. In a new system, learning a new field. So in a way, you're a big fish in a small pond, and then now you're a small fish in a bigger pond again. Learning how to manage your time and learning how to navigate new systems is definitely a skill that I think as physicians we have to learn over and over. Personally, something that I found was helpful to know and to learn over the course of my first year is to seek out mentors. For me, that, really set up, I think, my development as a nephrology fellow and my skills and my knowledge base is knowing who in your program you should ask for specific questions. I think there are so many subspecialties and so many other subtopics in our field, and there are many mentors that are available, both institutionally and from a national or even international perspective. So we're able to reach out to a lot of different people, and connecting with those people, I think, helps you to grow as a fellow. We're only here for 2 years, and so kind of hitting the ground running is very important.
So to that point about mentors, and I'm impressed that you're thinking about it both in the institution, but also more broadly at a national level or an international level. What's the time frame? So, if it's your first month of fellowship and you're getting to know the institution and you're starting to get to know who the key players are, both in terms of the faculty, but also your fellow, the other fellows. How do you start thinking about sort of identifying mentors and starting to build those relationships?
I think it's, it can be a mix of actually planned meetings and serendipity. We don't actually realize that people are quite eager to help us more than we think, both from and outside the institution. I've had the fortune of meeting, mentors at just chance, like there've been chance meetings at just, say the ASN Kidney Week. Or a local conference that I would go to, or as a matter of fact, even Twitter. So I think there's so many opportunities at this point, and I think ASN per se plays a very big role in this because I happened to apply for an internship on the Media and Communications Committee, and I got connected to nearly 20 mentors. So I think the onus is on you, no doubt about that. But there's also so many people out there who are so eager to help. So, I don't think anyone should have any inhibition about approaching people, for even topics that you'd be interested in and getting help on something.
I agree. I think as far as the time period for when to seek them out, I would do it on the first day. Even in this period where everything is virtual, there's still an orientation period where you talk with your program director who knows everybody who's in your institution, who can mentor you in whatever field that you might be interested in. And your program director would be able to, tell you this is the person that you should talk to. This is the person who's interested in the same type of research that you're interested in. And certainly, for me personally, I joined the Nephrology social media collective in January, that connected me with a whole nother group of mentors, and they were pivotal to me learning many other skills, a whole set of other skills as well.
So Tiffany, I'm just curious, when you'd mentioned developing new skills, I'm curious about a skill that you may have developed over the last 2 years that you couldn't have even have imagined as a potential something you would have needed to know how to do when you started.
I think the amount of autonomy that you have as a fellow is very unique, and it's very different than residency, where you generally work in teams, and as a fellow you guide another set of a team of residents and students, but you have a lot more autonomy, you make a lot more decisions, and you're also responsible for other people's education. So I think as a educator, that is a skill that you pick up in residency, but really becomes more refined in your fellowship as you delve into a lot more specialized knowledge.
Yeah, no, I totally agree with you, Tiffany. One of the things I've actually thought about as well is that the way we learn as well changes quite a bit. I think even changing your routine in response to, say, micro-learning, something that Gurpreet Dhaliwal from UCSF says, we're very busy and we're expected to be busy on consult service, but I think spending that time to learn things, having a focused, learning pattern, I think it's something, of course, you start that in residency, but I think it's a lot more pertinent to, fellowship, and especially nephrology fellowship, because the material is very dense and vast, and you want to make sure that you're learning quickly. So I think I definitely refined the way I learn things, and I think micro-learning and trying to also reflect on it a lot has definitely something that I've changed on.
Sam, how much have you been able to personalize your fellowship in terms of directing or spending time in the areas you're most interested in?
I think, my program per se has been very flexible about personalizing it per se, because in the end, you have interests that you want to refine. And I think it's, like I said, I think the onus is on you based on the discussions that you would have with your program leadership. It can be pretty seamless as well, but having that plan from the get-go, or even devising a plan, I think would be very important. Knowing what you want to achieve from your fellowship, whether it is going into transplant, going into, say, even critical care, or even now the new pathway of palliative medicine. So, even the interests, have to align with what you want to do in the future. So I think discussion with program leadership is extremely vital, I feel.
I agree. I think that as you go into fellowship, there are even subspecialties, and I think every one of my co-fellows in my program has a slightly different interest and slightly different track that they want to pursue. And so personalizing your path and knowing what your goal is right when you come in is very important. For me personally, I knew that I wanted to do transplant nephrology coming in, and connecting with the transplant team and knowing that I wanted to do my QI project in transplant, it sets you up for success to let people know what your goal is and being clear about it from the beginning.
If you were in a position where you could influence all the residents in the United States and say, you need to pursue nephrology and here's why, what's your case?
I would actually, I take a page out of what Atul Gawande once said in one of my favorite articles that he wrote, and it's called Heroism of Incremental Care. I think nephrology is kind of unique in the fact that in many ways you're a long-term comrade to your patients, say progressing from AKI to CKD to dialysis and the eventual, life-saving transplant as well. I think very few specialties offer that to you. I think a lot of us get into medicine for the people aspect of it, and nephrology completely fits the bill when it comes to that. So in many ways, you are providing incremental care to these patients, yet you're also very comfortable in a setting like critical care. As Atul Gawande says, we tend to reward specialties that have a lot of heroism and, one stroke and everything's good. You look after things in one shot itself. But I think nephrology combines both those things, incremental care and the heroism of critical care.
Tiffany?
Yeah, I see that all the time. In our consult service, we combine our ESKD patients, our end-stage kidney disease patients, as well as our critical care patients. And so we see both at the same time. We see people who we see again and again, our chronic patients, as well as the people who are acutely sick, who may recover. And you can see a broad range of pathophysiology from, intoxication to rhabdomyolysis to more chronic things.
I had asked at the beginning kind of, your advice to people who are starting their fellowship this month. I'm just kind of curious as to, well, how about if I ask it this way? What's your biggest mistake or biggest regret, or something that if you could avoid, you didn't need to learn by experience?
Something that I've learned over time, for sure, especially towards end of residency, going on to fellowship. I think we sometimes tend to get kind of drown in our own opinion of things. I think promoting, trying to promote your own individual self to, go out there and get the answers. And we tend to kind of get very closed off to, say feedback or opinions from the outside. So, I think it's very important to seek, even if you're seeing a consult, don't be thinking that this is just what I'm thinking. Be open to, even if a medical student or a resident comes in and says, I think it could be this, maybe you could consider that. Be open to that, because in the end, as we've discussed, medicine is a team sport. And as a consult service, you could easily fall into the trap of thinking that, yeah, this is what it is and this is what my diagnosis is. But, I think the moment you fall into that, there are a lot of mistakes that can happen. So just to make sure that you're listening to others, whichever stage of training they're at.
Tiffany, just curious as to your...
Yeah. So for me personally, I think shifting from residency into fellowship, especially with nephrology, a unique aspect of the care is that you're now a consultant service. And as a consultant, you're used to giving recommendations, but I would say to keep in mind that the patient is still yours. And I think it's important not to forget that even as a consultant, you still have to follow up on things, treat the patient as, as if you were primary.
So Tiffany, I'm wondering, I'd like to invite you to ask Sam a question. What do you want to know from him that I haven't asked?
It seemed like you do a lot of reading, and was there any book, outside of just your fellowship that has, changed the way that you practice?
I think turning to, I think moving when you're say you're done with a tough day at work or something, I think having an outlet, I find reading really centers me and keeps me going. I don't think you should read only on medicine, but I think reading reflections from other people who've been in your place in medicine really helps and consolidates why you're there and changes the way you're thinking. So, it doesn't have to be only reading that you have to be picking up, but take an outlet that inspires you to go back to work over and over. But for me, I have to say it has been reading as much as I like to say, and as much as I'd like to read. But I think the bottom line is having an outlet so that you can go back to work fully inspired.
Well, what practices do you think, what habits make a good mentee? We've talked about how, you can look for a mentor and when you should look for a mentor, how you should look for a mentor. But as a mentee and as a fellow, as a trainee, what are the habits that you should have?
I think tenacity is one of them. A lot of your mentors will be busy. It doesn't mean that you have to keep reaching out to them over and over, but I think with your own efforts, you have to be tenacious in making sure you get things through. I think mentors really, pick up on this trait for mentees that yes, they're tenacious enough to go after what they want and what they care about. And I think that's something that's really important in a mentee, because in the end, mentors, they're up there. They have a lot of commitments themselves. So, I think a mentee should not expect just constant encouragement per se. I think there's some effort on your part, and something that you should always be conscious of.
So Sam, it's only fair. Do you have a question for Tiffany?
Yeah, I promise it'll only be one, Tiffany. It won't be two. So I think a lot of people might not know this. Tiffany is also a very accomplished writer. She keeps on going on and on about me reading, but actually Tiffany writes really well. So Tiffany, how much do you think writing helps you as a doctor, as many doctors before you have done? And what advice would you have to budding medical writers?
Personally, I found that it's helped a lot. And actually, I can bring up some of my own outside of nephrology reading here. With there's a piece by George Orwell that impacted me a lot way back in the day. It's called Politics in the English Language, and it talks about clarity of thought as well as clarity of speech. And I think that in medicine and in fellowship, it's very important to be very clear when you communicate and when you express yourself to others. Not just when you're writing a piece or writing an article, whether it's an article in a published journal, but also when you're communicating with other people, when you're picking up the phone, calling consult, or giving recommendations, and when you're writing a note. I think it's really important to extract the important information and to express it in a way that really gets to the heart of the matter and does the best for understanding what the problem is for an individual patient or for a larger issue.
So I'm struck that you've both raised reading and writing and how important sort of outside outlets are, and if it's those two or others, that's another sort of habit for successful fellows. I'm curious on this issue of sort of physicians as writers. Someone like William Carlos Williams obviously comes to mind. Robert Stone. I mean, there's a number. Just curious as to who some of your favorites would be.
As I mentioned, I think Atul Gawande is probably my favorite. I think, as Tiffany mentioned, to distill thoughts with such clarity and simplicity. Of course, there are great medical writers out there, but for me, I think no one else does it better than him. I hope he's listening to this podcast so that he'll take me on as a mentee.
Sam, Tiffany, thank you. Sincerely, this has been great. And I look forward to finding a time where we can have a follow-up podcast in the near future.
Yeah, absolutely look forward to that. Thank you.
Thank you very much.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.